Hello, we have today a very special friend and guest. Is Dr. Mynzhylky from Kazakhstan. So welcome here to Link.
Thank you for the invitation and thank you for the Link Online team for live streaming from Almaty, Kazakhstan. We have done 2 cases this year, and for us it's a different experience. It's a very experienced team of Link Online, and yes, for us it was something new.
Thank you very much. We know you're very busy. You have a very busy center. Can you tell us more about Kazakhstan and the things you're doing there?
Yes, the Kazakhstan is the 9th country in the world by the territory. The structure is look like, I think, Australia. Australia is a 6th point in the country by the territory, and just 20 million population. It's a small population in a big territory. That's why we have nearly 20 big regions, and in each region we have regional hospitals which are more equipped, and they can do neurosurgical service and interventional neuroradiology, or we call it endovascular neurosurgery. And in Kazakhstan, the specifics of the territory, we specially prepared for the system interventional cardiologists and radiologists. They're just doing 2 months certification courses, and they can start to do brain aneurysm, thrombectomy, but it's still scary from dealing with brain AVM. Usually it's enough, and from my point of view, the half of the aneurysms, it's coilable, and it's possible to save the lives for these patients without sending to more experienced vascular centers. And I'm working in a presidential system in Almaty, and the presidential system is a little bit specific for the post-Soviet countries. We are serving the system of presidential affairs. We are serving the so-called city mayors and the guys involved in this service. And also we are treating patients from the healthcare system. We have quotation for those patients, and also the private. All is mixed in one hospital. We have Philips Azurion biplane cath lab, and in that cath lab we are doing more than 500 interventional procedures and nearly 200 diagnostic procedures.
I'm looking for the epidemiology of your disease. Do you have some special disease? I know that ICAN, for example, is a very prevalent in your country.
It's very specific because of the Mongolian genes, thanks to Genghis Khan. The territory is hypertensive. We have a lot of hypertension, and also the food culture. It's a salty food. We are taking a lot of fatty meal because of cold in the winter, minus 50 Celsius, and in summer it's plus 50 Celsius. That's why we have atherosclerosis. We have a heart atherosclerosis, multiple atherosclerosis, also intracranial atherosclerotic disease. It's very specific for the Japanese population and also for Chinese, and Kazakhstan is not out from this region. Brain aneurysms is still high number. One of my colleagues did a genetic trial, and in genetics we are close to the Japanese population. That's why sometimes my colleague from Neurointervention is asking why you're treating these 2-3 millimeter aneurysms, but we are closer by genes to the Japanese, and all these aneurysms tend to rupture because of hypertension and the salty meal, and the life expectancy in Kazakhstan is 74-75 years. That's why the cause of the mortality is atherosclerosis, and I think the aneurysms also taking the place.
And what are you expecting in the near future to develop in your country as an interventionalist?
As an interventionalist, I think the problem is a healthcare system. the healthcare system is mostly focusing on the hospitals, on the high technologies, but I think the most focus should be on the food traditions changes. We should limit the salt from the food, from the traditional foods. We need more activity, physical activity. And I have seen in France, many people is cycling, but in Kazakhstan it's a little bit complex to cycle because winter is nearly 6 months, in some territories more than 6 months, and it's not possible to cycle like in Netherlands and France. I think indoor physical activities is important, but in interventional radiology, neuroradiology and endovascular neurosurgery, I think the availability of products is opening the door for more active strategy. In ICAT, we have experience of more than 300 cases for the last 10 years, and the number is increasing. Brain aneurysms in my hospital, 99% is endovascular. We are clipping very limited cases. And also we are dealing with brain AVMs. In 2022, the first gamma knife machine came to Kazakhstan, and we have seen the decrease the number of patients with brain AVM coming for the endovascular treatment. But from last year, the number is again increasing. The patients is looking for the results of gamma knife, and yes, to be honest, it's not 100% effective. And with effect of 70%, the patient is scary. There is a lot of radiation damage, radiation injury for the normal brain. And they know that we are treating AVMs radically with more than 70% of complete exclusion from the circulation, and the seizures are disappearing usually after embolization. And now we taking more patients with brain AVM. Also, we opened the embolization of meningioma, and in the country we have huge experience. I think we have the biggest experience in the world with the meningioma embolization, and we are preparing the paper about this topic, and I'm planning to present our experience on brain conference in December in London. It's more than 300 patients already treated, and we saw that 50% of the patients with big meningioma were resect without blood loss, without elongating the time of the microsurgery, and it's very fast and easy comparing with losing the blood. And with occluded vessels, meningioma became like a cavernoma. It's very easy to resect. And half of the patients were not opening the skull. It's just embolization only. And we saw that 25% of these patients, meningioma is shrinking and disappearing. And the 25% is still remaining, but the size is not increasing. And from the neurosurgical experience, I'm a neurosurgeon. If the meningioma is not growing, you can follow this patient. You don't need to resect this non-growing meningioma. And I think it's a good way to deal with this kind of pathology. Yes, well, looking for the intracranial venous stenting, we started stenting for intracranial hypertension and also for tinnitus, and we have done more than 10 cases, and also kinking treatment. It's a post-Soviet culture that if the patient has a kinking, the vascular surgeons trying to resect this kinking, and after resection the percentage of nerve injury is very high, and comparing with the brain damage, I think the nerve injury, facial nerve, lingual nerve, hypoglossal injury, and the recurrent vagal nerve injury, it's really disabling. And the vascular treatment of the kinking, it's a new way of dealing with this kind of patients. It's done under local anesthesia, and they stay in the hospital just 3 days, and the patient has no scar on the neck, and yes, it's really safe, and it's really promising treatment option. Yes.
Well, congratulations for your amazing work. Thank you to Mynzhylky for your time and the interview.
Thank you. Thank you.